A pleasant good morning to you. It is Friday, November the 12th. I'm Shane Seeley and this is the CBC Morning Report. Now, the Morning Report is receiving details today regarding fresh proposals for the effective operation of safe zones in Barbados. It's coming from the Barbados Association of Medical Practitioners on the heels of their statement calling for the suspension of legislation governing safe zones. Joining me live is the president of BAMP, Dr. Linda Williams, to give some perspective on what really is a hot topic right now. Dr. Williams, good morning and welcome to the Morning Report.
Good morning, Shane. How are you?
I'm good and great to have you on. You had a long meeting on Tuesday where the Ministry of Health put forward what it thought was the best way to go forward with this safe zones. Of course, BAMP, you had another idea in terms of what these safe zones should really do. Talk to us about what you would want to see, and first talk to us about the problems that you've had with the present legislation governing safe zones.
Okay, so let me say that since Tuesday a lot has happened. We've been involved in the consultative process, and our main issue with the initial rollout was that the action was apparently, it appeared to us to be rushed. And so we were not able to contribute in any way to what is now going to be the definition of safe zones for Barbados. The safe zone, as we understood it, and what we were calling for was a requirement for healthcare workers to be vaccinated, or if unvaccinated or vaccinated, to be tested regularly. When you do that, what you're doing is you're decreasing the amount of vulnerable people in the care of healthcare workers who will be exposed to COVID-19. And this is a public health measure that's being used worldwide. This is not something unique to Barbados. And the reason for that is that we found that in large institutions, particularly in large institutions, nursing homes, psychiatric hospitals, geriatric hospitals, and national primary and secondary care centers, that's where you were getting large outbreaks of people who were infected. And so for us, what we wanted to see was a situation where we encourage vaccination in those places and where we had frequent testing as a means of surveillance in order for people who go there to know that they are protected and safe from being exposed to COVID-19. I think the confusion with the yeah, go ahead.
No, you can continue. You were mentioning the confusion.
Yeah, the confusion with the legislation that existed came about because it was also being interpreted as meaning that persons who were unvaccinated could not attend healthcare institutions, your doctor, your pharmacy, your physiotherapist, and so forth. And so because of that, it appeared to most people to be a situation where, yes, we were asking for the healthcare workers to have these things, but also the public, and that we understand now is not the intention in any way, but I think that's where the confusion arose with just ordinary people, lay people, reading legal documents.
So as far as you understand, are changes being made to the legislation to address some of BAMP's concerns?
Yes, we have understood and had long discussions with the Ministry of Health, with the Attorney General, and what we have come to understand is that there is a need for a lot of public education around what the legislation says and what it means.
Legislation governing safe zones, because initially I see Trinidad has done their own version of safe zones, and I'm more thinking that the safe zones would be catering to luxury areas of the economy, places which are not essential, so not medical institutions or other similar places where the public has to go to fulfill their daily needs. What is your take?
So that's correct. So we can't look at the other countries necessarily and say, well, what their definition is of a safe zone is ours. But what we agree with is that a healthcare safe zone is going to be different from a restaurant, a hotel, and so forth. And those areas definitely need to have not only the encouragement of workers to get frequently tested and vaccinated for the patrons, but also within those areas, you are then able to call for people who are vaccinated to be able to show that they're vaccinated and or recently tested to participate, say, in an entertainment program or in a restaurant or somewhere like that. And so for those areas, we absolutely agree that that is a public health measure or a tool that the government can use in order to increase safety within the country. But for healthcare and for essential services, that's different. We can't bar anyone, regardless of vaccination status, from accepting or receiving the care that they require. Because if we did that, even inadvertently, what we would end up with is a healthcare disaster, really, in terms of people who are presenting late. So we don't want that for healthcare, and so I think the differentiation is going to be for healthcare and essential services and what is meant for others.
Well, I'm happy that BAM has got that cleared up, and medical professionals in general, because the Barbados Nurses Association also voiced concern about the legislation in its present form. Coming back to those mandates, the BAM has been pushing for healthcare workers to be mandatorily vaccinated. What are you getting on that front? Are you getting pushback on that front still? Or is the Ministry of Health and Wellness more amenable to going in that direction now?
Okay, so I want to throw out the term because the term mandatory vaccination is causing a lot of confusion. So I'm going to throw that out, okay? Mm-hmm. And I'm going to say that in order for doctors and nurses to practice in general, all through our years and through our lifetime, we have had vaccinations that were required. Okay, in order to become a member of staff, you were required to have chickenpox vaccination and hepatitis B and a wide variety, MMR, DPT, etc. And because of that, we are saying that COVID-19 vaccine should be added to the schedule of required vaccinations for all healthcare workers. For some reason, the term mandate has been associated by members of the public in this pandemic to mean forcing someone, dragging and literally forcing. And that is not the intention at all, and that is not what we are calling for. If you think about it, we have a vaccine mandate in Barbados already. Children are required to have vaccination in order to attend school. And proof of that vaccination must be shown for children to attend school. This is an example, a vaccine mandate already in place. And so if the word mandate or mandatory is somehow causing fear and free, maybe we should not use that word. And we should call for the requirement for healthcare workers to be vaccinated so that we have the same situation that we ask for, whether it be any other infectious disease, in terms of our ability to protect the vulnerable public that we care for.
Dr. Williams, is always good talking to you so that you can shed some light on some of the issues facing us during this pandemic. This time around, it's safe zones. I know we will have more conversations in the week ahead, but thank you. Until then, stay safe.
Okay, thank you. Bye-bye.
Appreciate your time. Dr. Linda Williams is the president of the Barbados Association of Medical Practitioners, giving her take there on safe zones and mandates for healthcare workers to get vaccinated for COVID-19. She says she wants to throw that word out of the window. Of course, we'll have more stories coming from the Barbados Association of Medical Practitioners. And looking at our COVID-19 updates, Barbados changing its policy regarding booster shots. You'll hear the details up next. Leading our COVID-19 updates, Barbados has changed its policy on COVID-19 booster shots. Ever since the country introduced boosters, many people have been asking which jab they should or could take. Initially, Barbadians were being told that they had to stick to the original vaccine brand they took. However, co-coordinator of the National Vaccination Program, Dr. Elizabeth Ferdinand, told CBC News the green light has been given for Bajans to switch brands if they want to.
Yes, the boosters can be mixed. So in other words, if you've had a first course or primary course with AstraZeneca, dose 1 and 2, you can get either an AstraZeneca for your booster or you can get a Pfizer. Vice versa, if you've had Pfizer 1 and 2 dose, then you can have an Astra or a Pfizer for your booster dose. It must, however, be 6 months after your last second dose. That's the policy.
And however says the Johnson & Johnson one-shot vaccines cannot be used as boosters. 2 Barbadian males, ages 84 and 80 years old, died of COVID-19 on Wednesday. They were at the Blackman and Gollop and Harrison Point isolation facility respectively, and they were both unvaccinated. Confirmed deaths as at November 10th stood at 189. Now, regarding new COVID-19 cases, Barbados recorded 145 males and 155 females. Those results were taken from 1,910 tests conducted by the Best Dos Santos Public Health Laboratory. The new positives comprise 66 individuals under the age of 18. There are now 937 people in isolation facilities and 6,522 people in home isolation. Moving further afield now, the 2-day quarantine for fully vaccinated travelers to Grenada could soon be a thing of the past. Earlier this year, the 7-day period for quarantine for fully vaccinated individuals was reduced to 2 days.
Noting a steady increase in stay-over visitors as well as the number of flights to Grenada, Tourism Minister Clarice Modest-Cowan says Cabinet has taken the decision to further lift the restrictions at our borders. The Tourism Minister says the removal of the 2-day quarantine period for fully vaccinated individuals who have a negative PCR test on arrival will take effect from Monday.
Also, there are 1 or 2 little issues that need to be ironed out as to how we're going to do things, because we always have to be cautious about certain things. But the plan is to do away with quarantine for fully vaccinated persons, and within a week from now, that will happen. So,
Minister Modest-Cowan notes that changes must also be made to the regulations.
And therefore, I believe that the removal of the quarantine requirement for fully vaccinated persons will certainly make a difference. Because in the industry, sometimes people come for 2 days, they come for a weekend. And if you have 2 days in quarantine, then, you know, it's a waste of time. And even if you have 1 week, to lose 2 days.
He said a major factor in this decision is the low positive case count witnessed over an extended period. Acting Chief Medical Officer Dr. Sean Charles says the total of imported cases is 132 from the 5,863 confirmed cases.
In October, we had 5,164 arrivals at Maurice Bishop International Airport. We had 4 positive cases detected. 3 were not vaccinated. 1 was fully vaccinated.
Unvaccinated Grenadians returning home are still required to quarantine, while only fully vaccinated non-nationals or visitors are allowed entry under the current regulations.
Over in Germany, coronavirus infection rates are soaring and reaching new records days after the health minister warned that a massive pandemic of the unvaccinated was gathering pace.
Health authorities are saying the country recorded more than 50,000 new cases in the last 24 hours. Current finance minister and the likely next chancellor Olaf Scholz called a meeting to discuss new curbs to help overwhelmed hospitals. Several of the worst hit states have already brought in new restrictions on unvaccinated people. The outbreak's been blamed on Germany's relatively low vaccination rates.
Is take you into the Friday edition of Morning Barbados at 6:30. Pearson.
Shane, thank you. When you join me at 6:30 this morning for Morning Barbados, it is the month of November, which is always World Diabetes Month. And so the Diabetes and Hypertension Association of Barbados naturally will be celebrating this month too. This Sunday coming is World Diabetes Day under the theme Access to Diabetic Care. And we want to ask the question, how can we get involved? We'll meet with the president and someone living with type 1 diabetes. Also, the Kiwanis Club of Barbados South, they're in a drive to show that they care for kids with COVID. What is that drive and how can we get involved? And we'll introduce you this morning to a platform that is aimed at empowering children to improve their reading skills. We meet the man and the people behind that initiative straight ahead when you join me at 6:30 for Morning Barbados. Back to you, Sheen.
Thank you, Pearson. New developments unfolding in the renewable energy sector. We'll have all the details to this story and more after the break. As Barbados explores adding offshore wind to its renewable energy portfolio, the Ministry of Energy is laying the groundwork and sharing its vision for the future of clean fuels on the island. Our Leah Briggs has more on this story.
On the heels of COP26, the Energy Division is sharing its plans to generate clean energy from Barbados's most abundant resources. Based on the findings of the recently concluded ocean energy consultation, the most suitable solution could lie beyond the horizon. Program Manager in the Ministry of Energy, Keisha Reed, says offshore wind energy provides a once-in-a-generation opportunity for Barbados to diversify its energy portfolio.
Barbados, being a small island developing state, which I like to refer to as a large ocean state, needs to be innovative and maximize its ocean resource. And ocean energy can be a key tenet in assisting us in reaching our national energy goals for 2030, which is 100% renewable energy.
The proposed offshore wind turbines will connect to the national grid. Ms. Reid believes creating a reliable energy mix, inclusive of solar and wind energy, will reduce Barbados's carbon footprint while creating economic opportunities for Barbadians in an emerging sector.
It will contribute significantly to our renewable energy mix. We want to reduce our use of fossil fuels. It's a cleaner fuel. It will give us job opportunities, clean jobs.
The north coast of the island was identified as one of the ideal locations for fixed and floating wind turbines. However, given the costly and highly complex nature of this venture, technical and financial assistance is required. While it may be some time until wind turbines dot the oceanic horizon, for now, Ms. Reid and her team at the ministry are laying the groundwork.
The intention is not to have a situation where we're playing catch-up. We want to have everything in place so that once the technology and as the technology improve, when we go to market, that we are ready.
Aaliyah Briggs, CBC News.
The Minister in the Ministry of Foreign Trade, Sandra Husband, says businesses in Barbados must continuously seek to expand their scope beyond the island shores to generate real opportunities and prospects for growth through trade. She says members of the local accounting fraternity will have to play a key role in helping them to achieve this. The minister made the comments as she delivered the feature address on the opening day of the Institute of Chartered Accountants of Barbados annual conference being held virtually throughout this week.
We need to look at export, and we need to look at investment in other countries that we can build enterprises of scale that will allow us to do more in terms of trade. And therefore, our chief accounting officers, our financial directors, our top accounting people at the top of our organizations have to be a part of the leadership. And this speaks to your purpose in this moment.
She says businesses will specifically need to be helped in establishing export and investment-based models as part of their growth strategy. The minister notes that government has been playing its part in helping to spur that process by exploring both new and familiar markets.
We've been focusing on Guyana and Suriname, and to a lesser extent, Belize, as possible places for us to focus. Guyana in particular, because Guyana will be growing at 28% and above because of the oil, and I know that you already know this piece of information. But what has been challenging about Guyana is that Barbados has not been as present as other countries. Guyana has been able to attract people from across the world. They are pouring in at a tremendous rate. They only had a slight halt because of COVID. 800 companies from Trinidad are in Guyana as we speak. And the question we encounter every time we engage our counterparts, where is Barbados?
In sporting news now, first England and now the other favourites, Pakistan, have been knocked out of the ICC T20 World Cup. In yesterday's second semi-final, Pakistan were eliminated by Australia at Dubai's International Cricket Stadium. Pakistan posted a challenging 176 for 4. Mohammad Rizwan, he top scored with 67, while Fakhar Zaman made 55 not out from 32 deliveries, including 3 fours and 4 sixes. Mitchell Starc took 2 for 38. The Aussies, well, they seemed to be in trouble at one point. 96 for a 5 in the 13th over, but the player of the match, Matthew Wade, with 41 off just 17 balls, that included 2 4s and 4 6s, and Marcus Stoinis with 40, put up an unbroken 6-wicket stand of 81 runs. That led Australia to 177 for 5 off 19 overs and victory by 5 wickets. We have the highlights of the match. Australia and New Zealand, and that's on Sunday at 10 a.m. Live coverage is on MCTV's ESPN Channel 308 and Radio 94.7 FM. The final program of TV8's cricket talk show, World Cup Wrap-Up with Mark Seal, will be after the final at a new time, 4 p.m., and it will run for a full hour. Time now for a look at the weather. The temperature on the outside, pretty cool, 26.2 degrees Celsius. It's feeling slightly warmer, up to 29 degrees Celsius. The apparent temperature, the relative humidity stands at 78% this morning. The barometric pressure has risen a bit to 13.6 millibars. Those winds are coming out of the east at 25 kilometers per hour. We'll get a high tide this morning at 25 minutes after 11. The low will be later on in the afternoon at 17 minutes after 5. Those seas are smooth to moderate in open water. Swells are between 1 and 1.5 meters and holding steady. Today, here in Barbados, we'll get a mix of sunshine and clouds with a few brief isolated light showers. And tonight, we'll get a mix of clear skies and clouds with a few brief scattered light showers. Today and tonight over the Lesser Antilles, the picture looks like this. Fair to occasionally cloudy, it will be there with a few brief scattered light showers. And here's a quick look at the international weather forecast. And that's it for the Friday edition of the CBC Morning Report. I'm Shane Seeley. Morning Barbados starts now.
Wake up, wake up, wake up, wake up. Barbados, get up. Good morning. Good morning, Barbados. Good morning. Good morning to you. Good morning. Morning, morning, morning. Good morning. Good morning to you.
Indeed, a very good morning to you. A fantastic Friday, as a matter of fact, to all of you everywhere. Thank you so much for joining us this morning. Good morning, Barbados, here in Barbados, and those of you across the globe who are also watching us on our YouTube channel and on our Facebook streams. Remember to like our page, Morning Barbados. You can also see us there. You get some other information as well. So, having said fantastic Friday to you, let's just remind you what else is coming up today on Morning Barbados. We'll get to meet the new beauty behind Colleen's Beauty Supply under new management, but same old great service. And so she'll join us this morning to share about her vision for the new beauty supply. And we'll also meet Bajan Afar, who is resident in Canada, Nova Scotia, Canada. She'll talk to us about what she's doing there, and we'll get to hear how she's coping as a Barbadian in her space as well. But it's the month of November. We enjoy our conkeys. We enjoy all sorts of sweet things, but that can come with some health issues as well. It's Diabetes Month. And so joining us this morning to talk a little bit more about the month and particularly about Sunday World Diabetes Day. And the theme is Trudy Griffith, who's the president of the Diabetes and Hypertension Association of Barbados, and also Melissa Goodman, who is one living with type 1 diabetes. Good morning to you, ladies.
Good morning.
Good to have you indeed. Thank you for joining us. Now, as I started by saying, Trudy, we always like to eat some sweet things. It's Diabetes Month, and diabetes is one of those long-term health conditions that would affect how our body turns food into energy. From the Diabetes and Hypertension Association of Barbados, first, let's understand the services that you offer and how we can access diabetic care.
Okay. So the theme for this year's World Diabetes Day is access to diabetes care. And the Diabetes and Hypertension Association of Barbados was established in 1975, and there are 4 areas that we focus on. We focus on support, we focus on education, we focus on advocacy, and we focus on screening. Now, COVID does affect us, but at the same time, you can reach out to us. We are here in Beckles Road, so I'm actually at our office now. So we're here in Beckles Road, but you can also reach out to us via telephone 228-3422.
So easy, accessible. If you're in the central town area, basically St. Michael area, you can go into Beckles Road, there you are, or give you a call, because even though there's COVID, you still reach out and offer support and sort of like for those who are diabetic. So break down that support. I want to know, if someone has been diagnosed with diabetes and they reach out to your association, what exactly it is that you can do for them.
Now, I just want to emphasize that when someone has been diagnosed with diabetes, it almost feels as though their world has fallen out from under them. They don't know what to do. One of the questions that persons frequently ask is, what do I eat now? And now that we're in the month of November, as you reminded us before I started, is that, you know, we like conkeys, we like pone, cassava pone, we have sugar cake, all the delicacies that we associate with Barbados. And it's not as though we say you can't consume those items. It's a matter that you need to do so in moderation. So we are here because we know that your world has changed. We know that you don't understand now how you should eat. So we are here to provide counseling and to provide advice in terms of how you can make small changes in your life to get your diabetes under control.
Melissa, how long have you been living now with type 1 diabetes, and did your world follow under you when you got the diagnosis?
I was living with type 1 diabetes for 8 years and going. Type 1, when I first found out that I was diagnosed with type 1 diabetes, it was a little, they say I was a little bit better because I did everything right. Like, I eat my vegetables, I was exercising, I was playing basketball, playing netball. I used to model, so it was a shocker for me, I should say.
So what made you go have to be tested for diabetes?
Well, at first I had chikungunya, and that probably stirred it up, but it was in my system. What can I say? So I was going to school, and my mother was a single parent, so one particular day because I felt like I was losing weight. Like I was doing a lot of strange things. I was losing weight. I was always urine a lot. Like every time I drank water, I always wanted to pass water. I had diarrhea. Like I had all of these symptoms of a type 1 diabetic. But you know, like in the youth, you would go on Google and you would go and research stuff. So then it was talking about cancer and diabetes and different little things. So one particular day, I asked my mom to take me to the polyclinic, and she took me. And I told the lady how I felt, and she injected me with a gravel injection. And my mother took me to her friend, and he told my mother that I looked like if I was going to go into a shop. So at that point, she took me to a private doctor, and the first thing they did was check my urine, and my sugar was 28 and rising.
Hi. Indeed. And ever since then, in terms of access to care, now that you know your condition, you knew it right away, and so you had to put things in place to be able to manage your type 1 diabetes. Access to care is the theme. Have you had challenges? Was it easy? How has it been for you in terms of accessing care as a type 1 diabetic?
Okay, so when I first found out I was diagnosed, I had this one nurse lady asking me now, but she was the one to tell my mother about the Diabetes Association. And when I came out a few days later, I signed up, and from there, and then they had always like helped me with my stuff, like my strips, my insulin, because when I was given the medication that the hospital was giving for free, I was allergic to it, so my mother had to get a different type of medication, and it was costly. Before the Diabetes Association had a life touch health, so I would have purchased from Barbados and from
okay, it doesn't matter where, but you've had some challenges in cost because of cost.
Pardon me?
Okay, that's fine, that's fine. I understand you, but truly, and there it is, when it comes to accessing diabetic care, for a lot of people it's the cost. And so access oftentimes is hindered because of the cost. And it takes a lot for your association also to be able to help people meet those costs. So how can us ordinary Barbadians help the Diabetes and Hypertension Association of Barbados continue to allow people to have access to good diabetic care?
So let me follow on from where Melissa left off. So we have a sponsored Child with Diabetes program, which is specifically for children diagnosed with type 1 diabetes from the time they're diagnosed at whatever age up until the age of 25, where we cover the cost of insulin supplies as well as the medical care which they're going to need to manage their diabetes. So when we estimate that cost, that could be anywhere from 4,000 to 8,000 Barbados dollars every year. Now, when we consider that we have perhaps at least 100 children or perhaps more in Barbados with diabetes, you can understand the burden that families will face. So you have the Made Aware Barbados. We have a Blue Dollar drive on right now where we're asking you to donate your Blue Dollar, your $2 bill, to the sponsored Child with Diabetes program, because for young persons like Melissa is a phenomenal young woman. She hasn't mentioned it, but Melissa is a young mother. So I want persons to appreciate that just because you have diabetes does not mean that you cannot live a full life. That is exactly why the association exists, to make sure that persons can live a long, healthy life. So we do have a partnership with an entity in the U.S. called Insulin for Life USA, where persons who cannot access the medications which are on formulary because they may have particular challenges with those products, we try to source those products from overseas and we pass on that to our members. So really and truly, if you need access to diabetes care, come to the Diabetes and Hypertension Association of Barbados.
Indeed. The $2 drive, sorry, the Blue Note drive or the $2 drive, and you're asking us to donate as many as we can. You know, how can we do so? How can we ensure it gets to you and it does the purpose it's supposed to serve?
So we have two partners which we have the donation boxes located at. So every location of Republic Bank and every location of Rubis gas station, there will be a donation box. So you can go to any of those locations and donate one or more blue dollars.
That's right. So any Rubis or any Republic Bank are the locations in which we can drop our blue notes or $2 notes into the box.
That's correct.
Because every cent, literally every cent goes towards allowing access to good diabetic care. And so far we've done very well. The Diabetes and Hypertension Association of Barbados is very active and is still providing a lot of hope for a lot of people living with diabetes, which is not a death sentence, it's management of your health
correct.
concern. Now, Sunday coming is World Diabetes Day, and I know there are a number of activities still outstanding for the month which you're going to be recognizing. Could you tell us what's upcoming?
Okay, so Sunday is World Diabetes Day. It falls on a phenomenal day because we always have a church service to observe World Diabetes Day. And this year is particularly special because this year we're also recognizing the 100th anniversary of the discovery of insulin. So as you heard Melissa talk about insulin, and I made some comments as well, you would appreciate that without insulin, a lot of persons would not be here with us. So therefore, we are going to have our members and you, the public, you can join us as well. Whether you wish to come in person or you want to join us online, you can follow us on the live stream for the Abundant Life Assembly. The service starts at 8 a.m. So you are welcome to join us for that service on Sunday. And then on Tuesday, our signature event on the calendar this month will be the John Grace Memorial Lecture and Panel Discussion. So Pearson, those Barbadians out there who remember Mr. Grace as one of the stellar persons who has been championing the cause of diabetes in Barbados, we have honored him in this way to create a legacy lecture in his honor. And we will be having that on Tuesday, and it will be virtual. So you need to register in advance. So visit our website, visit our virtual platforms, Facebook and Instagram, so you can click on that link and register. Dr. Carla Goddard is going to be our featured presenter on Tuesday evening. So if you want to hear more about access to diabetes care, join us on Tuesday evening on Zoom or our live stream to participate in that event.
And it's a panel discussion, so you'll also get a chance, no doubt, to interact as well.
That's
Pose your
correct.
questions for clarity.
That is indeed correct.
All right, this sounds really packed. I love the Blue Note donation drive. I think it is so critical whether we live with diabetes or we know someone who is living with diabetes or we ourselves don't know have diabetes. We can still lend to support access to diabetic care by donating or Blue Notes or $2 bills. And sometimes a $2 bill can be irritant for a lot of people. It's just so small, you know, so drop it in the box. If you feel a little annoyed that somebody gave you a $2 bill, drop it in the box because it will go a long way to helping those with diabetes indeed. And the association is grateful for every ounce of support that you can lend. All of these drop boxes are available at every Rubis service station or at every Republic Bank branch. And certainly as you do so, you're knowing that you're giving to a very worthy cause. Melissa, congratulations first of all on being a mother. And I want you to look into the camera and tell all young people like yourself who experience all sorts of physical changes but are confused, encourage them to come forward for assistance. What do you say?
Yes, please. Okay, well, I should start by saying that not easy. When I first found out that I was pregnant, I was a little under the weather because my mind went to I don't want to go DKA, which is diabetes ketoacidosis. That is when your body and you're vomiting a lot and stuff like that, and I didn't want to be in the hospital, and COVID is going around. So how, like, I would tell persons, like, if you want in life, just go for it. But me having a son, it was not planned, it happened. So I living with diabetes, and being pregnant was a little challenging for me because I had a lot of underlying conditions. Like I have high blood pressure now. Um, I I had preeclampsia, shortness of breath, and stuff like that. But it wasn't per se hard. But just like my friends, when I was pregnant, most of my friends were a little afraid that they would have lost me as a friend. And persons living with diabetes, like, don't set your mind that you can only do one thing.
Yes.
You should always set your mind like you could do plenty of things. Yes, I'm a mother, but like sometimes I find it challenging, like checking my blood sugars. I don't always check it on time. I work, so I don't really get the chance to do what I supposed to. But every chance that I get, like I would put my phone to alarm, so
Right.
that it will be a reminder while you check your blood sugars
Right.
and stuff like that. I'm not going to sit here and tell you it's easy.
So you've built in a
Because having
routine.
diabetes and being a young mother
Yeah.
is challenging.
I know. You've built a routine, which is a fantastic thing. I want to thank ladies, both of you, for joining us this morning and implore all of us really to join you in all that you're planning. The church services on Sunday. You can watch it on YouTube, the Abundant Life Assembly Church, and see it there. On Tuesday is the memorial lecture, the John Grace Memorial Lecture. You should register as soon as possible. It's a panel discussion also, a chance for you to ask questions and answers. But most of all, donate, 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 donate. And I want to thank you, Trudy, President of the Diabetes and Hypertension Association of Barbados, and Melissa Goodman, who's living with type 1 diabetes, for joining us this morning and again heightening our awareness about this chronic disease and how we can live and have access to good diabetic care as well. Thank you so much.
Thank you so much as well.
You're very welcome indeed.
Thank you for having us.
You're very welcome. As we go to break, I want folks to look at how you can donate to the Hypertension and Diabetes Association of Barbados.
When you see that blue circle, don't ignore it no more.
Hi, I'm Crystal Boye.
And I'm Patrick Salt Bellamy, and we are proud brand ambassadors for Republic Bank, here to tell you about the Diabetes and Hypertension Association of Barbados' big Blue Dollar Drive.
As part of the World Diabetes Day celebrations, the Diabetes and Hypertension Association of Barbados is asking you to support their Blue Dollar Drive all month long.
Republic Bank is a proud sponsor of the Blue Dollar Drive, as well as other activities during the month of November.
Every $2 donated will help the Diabetes and Hypertension Association of Barbados to provide much needed support for children living with type 1 diabetes. I myself was diagnosed at just 10 years old.
You can make your kind donations at any Rubis service station or Republic Bank island-wide.
The Diabetes and Hypertension Association of Barbados thanks you for your support of the Blue Dollar Drive. We would also like to thank our valued partners, Republic Bank, We're the One for You, Rubis, Get Going, and Glucerna, Live Every Moment. Thank you.
You see that blue circle, don't ignore it no more.
Morning, morning, morning. Good morning. Good morning to you. morning, morning, morning. Good morning. Good morning to you.
We are 8.5 minutes away from 7 o'clock as we turn our attention now to the ongoing work of the Kiwanis Club of Barbados South. Joining us to talk about this brand new initiative, of which we can be a part, is the president, Deanza Ford. Deanza Ford, good morning to you.
Good morning.
The name was Roberts, as I knew it.
It is still Roberts.
Oh, just checking there. Deanza Roberts, so good. I was about to say congratulations.
No. I don't know where Ford came from. Never heard of it.
So we're very clear. You're very welcome. So congratulations, first of all, as being president of the Kiwanis Club of Barbados South. I love the initiative, which is caring for kids with COVID. Why this particular project?
Well, this project is the brainchild of our Youth Services Committee Chair, who's distinguished President Zelma Daisley, and you should know Zelma, of course.
Yes.
And Kiwani's international motto is serving the children of the world. And during the past year, we've seen a lot of children contracting COVID, and we thought that it was a good way to give back. The children are in the facilities, and in a lot of cases, they might want something to read, something to do, So you know what? We came up with this idea that that's a way of giving back. And so when DP Zelma would have put it to the committee and the board, it was a go. It was a go.
Yeah, I'm sure for a lot of children it's a very scary time. Not only are they themselves dealing with it, but they're hearing of all of the people around them who are affected by it. And so this project, no doubt, brings a lot of cheer, joy. It distracts them almost a little bit for what's going on, but it reminds them that life is also beautiful. There's a lot of beauty in life. So talk to me about how we, ordinary citizens, can join you in this effort, and what is it you're looking for?
We are looking for donation of books, donation of crossword puzzles, donation of crayons, different donations, pencils, whatever it is. Yes, as you see the beautiful flyer. So you can donate anything to this initiative by we're not looking for you to give us the money, but if you do, we will buy the stuff that's needed, because we want to, by December the 18th, I think, do a handover to the facility with these items for these children. And I know it will bring a sense of joy to them.
Absolutely. I can't agree with you more. So for anyone who wants to make the donation, then how can they do so?
You can call 233-2076, or you can call 848-5433 and make contact, and indicating where we can pick up, or we can tell you where to drop off and stuff like that. But we really just want, even a lot of people have books that their children not using, that's still in good condition, that they haven't been marked up. Give it to us so we can give it to the children, because we believe in, as I say, our motto is serving the children of the world. So we're really excited about this initiative, very excited.
And I'm glad you said it, because and don't just pass on things that you are irritated by because it's taking up space in your house. Think of your child and what you would want for your child to receive, which is a book in very good condition, whether it's used or not.
Exactly.
And you can give as many as you possibly can, because it's every bit that counts. And we hear the numbers every day of the people under 18, and our hearts flutter every time we hear it. But so there are quite a few children who are living with COVID. And so we want to bring some joy and play back to their experience as well. A lot of these are activity books, though.
A lot of them are activity books, crossword puzzles, dot to dots, Children get the crayons and so we understand what they're going through, and we want to basically ease that tension that they have at the facility. And I mean, even as Kiwanians, when we even go out and we do things like that to other children who are not COVID infected, for example, we see the joy on the faces of children, and we just want to keep that joy on their faces. So we really want Barbados, everybody to reach out and do what you can. There are a lot of facilities and there are a lot of children, and we just really want to help.
How large is your team that will be mobilized? Because I'm sure people will be calling you off the hook, and so your donations might be spread right across the island. How large is your team who will be able to mobilize and come collect?
Well, we have 63 members, and I must say, at Kiwanis Club Barbados South, everyone always put their hands on deck for projects. So, for example, if they call call the number and somebody is not able to get, we all over the islands. We in St. Philip, people live all over, and getting the items will not be a problem. So, if you can't come to us and we can meet you somewhere, we will. We definitely will.
In other words, let that be your headache. Don't worry about it. Just call
Yeah, don't worry
and make
about
the
it. Just call
donation.
us. Just call us, and we are ready and willing to come.
Indeed, so and that's what's critical, because for someone living in
So
St.
true.
Lucie, for instance, don't think it's too far because it's Kiwanis Club of
Exactly.
Barbados South. No, if you're St. Joseph, St. Andrew, don't worry about where the club is called. It is the fact that you want to make a donation, and you just simply call 233-2076 and make arrangements. Let them know what you have,
Right.
how many you have, and you arrange a time
Correct.
or a place, and you
Of
can
course.
safely hand over. And that's what's important. The
Very
COVID, though, in
important.
terms of it being able to allow, well, changing times, how are you able, as a service organization, to be able to still to do your work within the community you serve as Kiwanians?
As Kiwanians, we usually will have our Tuesday meetings every Tuesday, and our home is in Southern Palms. But since COVID, we've been having it online. We've been having all our meetings, our projects, our fun activities, everything online. So we have still been able to do everything. Um, it, yes, the face-to-face is not there, but we're still getting through and we're still doing well. Just recently, we had our one-day project where we went to our close park in Wildy. It wasn't a big team, but we came together and we were able to paint and as I rightly said, we brought smiles to the children's faces in that area, because by the next day they were in the park. So as Kiwanians, we understand that the pandemic has prevented us from meeting face to face, but guess what? We are moving with the times, and we are not settling. We are still pushing, and we are still pushing for the children of the world.
What does it mean to you, Dianza, to be a Kiwanian?
It means everything. I love volunteerism. I love children. I know what it is like not to have. So when, for example, you can give, and I believe in this life, we have to develop that passion of giving back.
Yes.
You could be living in a community and a plate of food for somebody, not because they might just don't want to cook. You see things every day. We right now we're preparing for independence hampers, and every member gets 2 or 1 hamper, and they just give back to somebody in the community who wants it. Somebody at work who's in need. People are working, but they're suffering, and so Kiwani mean everything to me. It means a lot. I'm a mother, I'm a sister, I'm a Kiwanian. I just love being a Kiwanian, and I love being a member of Kiwanian Club South as well.
Yes.
But not because I'm in South. All the other clubs, we come together. We
I feel
really
it.
don't work in a vacuum. We do not work in a vacuum.
Yeah, I feel your passion. So once again, remind us of
Yes.
about the care for kids with COVID.
Our care for kids with COVID, we want you to dig deep, not just in your pockets, but even in the corner of your houses, and bring out the books for the children, the crayons, the dot to dot, the crossword puzzles, and all of that. Once you have it, you can call 233-2076. Primarily, that's the number, or you can call 848-5433. Tell us what you have. You don't even have to tell us what you have. Just tell us where we can collect.
Yes.
And I'll make on our Facebook page, we have the flyer as well. So it's Caring for Kids with COVID, Kiwanis Club Barbados South.
Fantastic. Well done, Dianza Roberts, President
Thank
of the
you.
Kiwanis Club of Barbados South. I want to encourage all Barbados to join hand in hand with you, and let's do this together. Thank you so much for
Thank you,
joining us.
Person.
You're
And thank you
welcome.
for having me.
You're very
Thank
welcome.
you.
That's it. So we're going to take a break here, and we're coming right back with more on Morning Barbados.
Morning, morning, morning. Good morning. Good morning to you. Morning, morning, morning. Good morning. Good morning to you.
It is 2 minutes after 7 o'clock. Let's get the news. Here's Shane.
Here's your 7 a.m. headline news, and you heard it first right here on the morning report this morning. There will be a change on the policy and the legislation governing safe zones in Barbados. Confirmation of this came from Dr. Linda Williams, the president of the Barbados Association of Medical Practitioners. This has come after some long consultation, according to her, with the Attorney General's office and the Ministry of Health. Here's what she had to say.
We have understood and had long discussions with the Ministry of Health, with the Attorney General, and what we have come to understand is that there is a need for a lot of public education around what the legislation says and what it means. There will be some changes that will help to clarify for the healthcare worker the situation and what the legislation means in respect to other legislation that already is in existence governing labor.
Now, there are some other areas of the economy that Dr. Williams says would benefit from being governed by the safe zones, as well as it would encourage vaccination and testing and ensure a safer environment for patrons who attend these events and venues.
Within those areas, you are then able to call for people who are vaccinated to be able to show that they're vaccinated and or recently tested to participate, say, in an entertainment program or in a restaurant or somewhere like that. And so for those areas, we absolutely agree that that is a public health measure or a tool that the government can use in order to increase safety within the country. But for healthcare and for essential services, that's different. We can't bar anyone, regardless of vaccination status, from accepting or receiving the care that they require. Because if we did that, even inadvertently, what we would end up with is a healthcare disaster, really.
Meanwhile, we hear that Barbados has changed its policy on COVID-19 booster shots. Ever since the country introduced boosters, many people have been asking which jab they should or could take. Initially, Barbadians were being told that they had to stick to the original vaccine brand that they took. However, the co-coordinator of the National Vaccination Program, Dr. Elizabeth Ferdinand, told CBC News the green light has been given for Bajans to switch brands if they want to.
Yes, the boosters can be mixed. So in other words, if you've had a first course or primary course with AstraZeneca, dose 1 and 2, you can get either an AstraZeneca for your booster or you can get a Pfizer. Vice versa, if you've had Pfizer 1 and 2 dose, then you can have an Astra or a Pfizer for your booster dose. It must, however, be 6 months after your last second dose. That's the problem.
However, Dr. Ferdinand has made clear that the Johnson & Johnson one-shot vaccination cannot be used as a booster. 2 Barbadian males ages 84 and 80 years old died from COVID-19 on Wednesday. They were at the Blackman and Gollop and Harrison Point isolation facilities respectively, and they were both unvaccinated. Confirmed deaths have now risen to 189. Regarding new COVID-19 cases, Barbados recorded 145 males and 155 females. Those results were taken from 1,910 tests conducted by the Best dos Santos Public Health Lab. The new positives comprise 66 individuals who are under the age of 18. There are 937 people in isolation facilities across Barbados and 6,522 in home isolation. And in other news this morning, a senior magistrate is in support of the use of electronic monitoring for people on bail. Chief Magistrate Ian Weeks weighed in on the issue of electronic bracelets during the latest Man Talk panel discussion. It was hosted by the Men's Ministry of the Cave Hill Wesleyan Holiness Church, and the topic was jail time.
The Bail Act speaks about conditions of bail. So there are a number of conditions that the judicial officer can set up for persons. And where there are concerns, I am sure that you will have very few defense attorneys who will not support it. Because in a case like that, we can track where you are. We can know for sure. And there are not cases where you can just get out of a bracelet. And that is one of the options that can give the balance to persons where we know where you are and we know that you're fulfilling one of the conditions or some of the conditions of your bail. So I believe that that is a very useful option, and again used widely in the international community.
And that's your 7 a.m. headline news. I'm Shane Seeley. Back to you, Pearson.
Shane, thank you. Our time is now 8 minutes after 7 o'clock. We're taking a break. 8 minutes after 7 o'clock. We're taking a break, and we're coming back with more on Morning Barbados.
Morning, morning, morning. Good morning. Good morning to you. Morning, morning, morning. Good morning. Good morning to you.
9.5 minutes after 7, time for your Crumbs question of the day. Time, give me a call, 228-5562 or 228-5563. It's Friday, so I promise you it's going to be easy, easy, easy. 228-5562 or 228-5563. Here comes today's Crumbs question of the day. Are you ready? Call me now. 228-5562 or 63. Look, there it is. Where is Crumbs Bakery's head office? I told you yesterday. Where is Crumbs Bakery's head office? 228-5562 or 228-5563. If I knew this question was coming today, I would not have said what I said yesterday. But such is life. So, where is Crumbs Bakery's head office located? Where is it? 228-5562 or 228-5563. Call me right now and let's see if we get a winner out of you. Good morning, hello.
Hello, morning.
Hi, good morning. Where are you watching us from?
St. Andrew.
St. Andrew. St. Andrew, do you have an answer for me?
Number 11 building, Willie St. Michael.
Number who, what?
Number 11 building, Willie St. Michael.
So where do I start to count? Let me see if I got you. See if you have the correct number. Where does Willie start? And let me count the numbers. Let me go. Go ahead.
No, I'm sure I heard it.
I listen to you. So how do I know it's number 11?
I know it's number 11. I know about you.
How do you know it's number 11?
Because I heard it already.
Because you heard what already? That is at number 11?
Yeah.
So it's on the main road or is it on one of the side roads?
It's one of the side roads.
Which side road? From where? Drive me to it. Come.
From Automotive Art to the Automotive Art, it just come down shore there.
So I go onto that road off the main and I turn somewhere by Automotive Art?
You turn by the gap by Automotive Art.
So I take that turn?
And you drive down a little.
Mm-hmm.
It's on the right-hand side when you're driving down.
How you know you went down there?
I always down there.
You do what down there?
I go down there.
You go there?
Yeah.
You go to the head office?
Sometimes I buy bread from there.
You go to buy bread from the head office? Why, you thought you get it cheaper?
From the from the bakery, not the head office.
But that's just, why? Because you think you get it cheaper there or something? Why do you go there?
No. Because I pass there regularly, so I stop in.
But you live in St. Andrew. What are you doing down there?
Because I pass there sometimes.
What are you doing down there? Sorry for pressuring you like that. You know, you're right. It's in the industrial park, as a matter of fact, the building industrial park. You're so right. It's building number 11. Congratulations. What's your first name?
Lucy.
Hi, Lucy. And where exactly in St. Andrew are you?
Bordens.
Ah, I know you. I know you. You think I? Listen, you remember there was a man named Tom Jones?
That's my uncle.
Small world. And I understood he passed, right?
Yeah, he passed.
Yeah, I would never forget Tom Jones from my radio days. Tom Jones from Borden, St. Andrew. Describe Bordens for me. How would you describe the area in which you live?
It's a small area. A quiet area.
You like it?
Of course.
But you lived there practically all your life?
Yes, I lived here all my life.
You never got tempted to go live somewhere else?
Nope.
For true?
Yeah.
Or you get the question asked of you to take you somewhere else? All right, Lucy, you stay on the line. I wouldn't go any further there. Stay on the line. We take some more information from you, but congratulations. Absolutely right. It's available there in building number 11 in the Building Industrial Park. That's the head office of Crumbs Bakery. We're going to take a break here, and we're coming back with more on Morning Barbados.
Morning, morning, morning. Good morning. Good morning to you. Morning, morning, morning. Good morning. Good morning to you.
14 minutes spot on right after 7 o'clock. I just love the fact that our next guest says that she's a believer in love and the power of love. She's Venezuelan and she's been living here now for about 7 years. She's quite creative as well, and so we want to introduce you to her creativity. Her name is Elsie Rojas. She's the owner of Lurts, and interpreting for her this morning is Eric Yoso. Did I get that right? Good morning, Elsie. Elsie. Elsie seems to be stuck.
Hi, Miss.
There you go.
Hi.
Is your interpreter with you today? How are you doing, Elsie?
Yes.
Yes, I'm here.
Okay,
Good
good
morning.
to have you. Good. So off, but you're
Good,
there.
thank you.
You're very welcome. You are from Venezuela. You've been living here in Barbados now over 7 years. And you believe you are a Bajan at heart. What makes you say that?
Yes. Yes.
Why do you say so?
Because I love Barbados. I love the Barbadians. Barbadians every day smile and happy.
I am looking behind you and I'm seeing evidence of some of the work that you do. You love to draw hearts everywhere simply because you just love love. Tell me about where your passion for art began.
It's my passion because I believe in the love. I believe in the true love, in the power of love. Love is love. I believe in love.
Indeed, love is love, and you love love. So I'm looking at the name of your business, Lurts. I suspect you've just replaced the H with the letter L.
Yes. Liard is L is first letter for my dad, for my husband, for my kid, for my dog, and E is my name, and together is Liard.
Oh, Liard. I pronounced it badly. It's Liard. And I mean, it almost spells the word heart. To begin with, you just change the letter H to L. Liard is who you are. You said you're a mother of 2 boys and a dog. That's who you are. That's who you identify as. And
Yes.
tell us where your art is represented, because I'm told that you paint on canvas, you paint on bags, water bottles, anywhere that you can paint. Am I right?
Yes, I like paint everything. I like paint canvas or shoes or bag or whatever. I like paint.
So how would you describe your style of art?
I'm crazy.
Crazy?
Yes, because it's an explosion of color and it's free. It's just passion.
Wow, there we're looking at our screens and we're seeing some of your wall art. We've seen how you've taken suitcases, even travel gear, and you've decorated it with your art. We found your art at beaches. It can be anywhere, and that's the whole point. That's the whole point. And every shape, however, is in the shape of the heart as we see it. And that's because you are just driven by hearts. As if you could feel the pulse beating within the chest every time, just exuding the best of who we are. How long have you been doing this kind of art now?
Maybe 2 years, and 3 years ago, and I started a project with my beautiful friend Lina. Lina and me creating and painting a good furniture, but Lina left the island, and then COVID came.
Mm-hmm.
And the situation is really, really bad for me because I lost a lot family, and I'm crying every day, and I'm really sad.
Yes.
But God is good, because one day, I don't know, I thinking is God tell me, hey you, what's up? Don't cry. Yes, dancing and paint and live and I stay here.
That's right. And so art is like therapy for you. It became therapy, but look, it's become quite a commercial activity for you as well. So for those watching who see your art and see the energy in your art and the comfort it can bring to them, how can they access pieces of your art?
My Instagram is Liart, find me, or in my collection.
What do your boys think about the work that mommy does?
My kids study, and mommy is funny, and every day mommy paint everything. Oh my God, mommy paint my pants. Yes, paint.
So they enjoy it just as much as you do?
Yes, all my family enjoy.
Oh, that's great. How many hours in a day do you think you put aside just to do your art?
Maybe 2 or 3 days, depends.
This is fantastic. I really am so happy to have met you today. Lee Arts is found on Instagram. And of course, once we find you on Instagram, we can make arrangements with you to say, make me a piece for this particular accent wall or whatever. And we negotiate with you from there. That's fantastic.
Oh, thank you so much. Thank you so much.
If it was not art, what else would you think you want to express? How else would you want to express your emotions, do you think?
Dancing.
You are so expressive, clearly. Very expressive.
I close my eyes and dancing, and when I dancing, I creating and painting.
That's the beauty of art indeed. Elsie Rojas, we want to thank you so much this morning. You're the owner of Lee Hearts. Lee Hearts is available on Instagram. It's great work that she's doing, and she can customize anything for you, whether it's on the water bottle, on a pillow, almost on your luggage. And just abstract art, it is great art indeed. It comes from the heart because she has a passion for love and the power of love. And so with her journey here, with the Barbadian pulse in her veins, that's who she is. Thank you so much for joining us today.
Thank you so much. I appreciate your help me. Thank you so much.
You are very welcome. It's 22 minutes after 7 o'clock now. We'll take the break and we're back with more.
Morning, morning, morning. Good morning. Good morning to you. Good morning. Good morning to you.
23 and a half minutes now after 7 o'clock. I'm sure a number of you at home have children who at the sight of a book run the other direction, or just at the mention of the word, come on, start to read, freak out. And so we want to be able to make it a whole lot easier for you this morning. We'll introduce you now to a system that's actually a platform that can actually make reading fun for the children. The man behind all of it is Aaron Friedland. He is the Chief Executive Officer of SIMBI and founder of and Executive Officer of the SIMBI Foundation. Aaron, good morning to you.
Good morning, Pearson. How are you?
I'm well today. Thank you for asking. How are you doing?
Doing really well.
That's fantastic. Tell us about SIMBI and why you started this particular platform.
It's a great question. So I'm dyslexic. I struggled learning to read when I was growing up. And teachers noticed that, essentially they just didn't think I'd ever make it to university being dyslexic. And they discovered that actually if I read books and listened to those same audiobooks, so imagine you're reading a book and listening to the audio at the same time, that could help teach me to read. And that approach worked very well for me. And many years later, I was working in Uganda in the refugee settlements, and I wanted to understand if the same approach that taught me how to read could be applied in this context. And so built a very simple application, asked students and parents in North America and other countries to select books on SIMBI and to narrate them, to read out loud. Mm-hmm. And then SIMBI would capture their voice and capture the text and add it together so that kids in the refugee settlements and elsewhere could actually read and listen the same way that I had learned how to read. And what we discovered was that, one, the students in Uganda were becoming significantly better readers, but two, all of the people who had narrated books for social good loved reading. And they wanted to read more books for global literacy and global impact. And so SIMBI was born. And today we are deeply excited to be able to work with Barbados. We've been approached by quite a few educators as well as the Ministry of Education to bring the reading platform to support education, specifically during this incredibly difficult time for virtual learning and for learning in general. And so I'm deeply honored to be here.
Thank you so much. And you know, oftentimes when we hear someone narrate, you can get lazy. You can just sit and listen and that's it. But you're advising through this platform, no, just take the book. For all of your reading literacy, you need to be able to see the word so you recognize the sound of the word and put it into context as well. Reading for a lot of us, for me, particularly growing up, meant that I could use my imagination. It can take me into places and spaces where ideally, physically, I could not be. And here it is now, this platform allows us to do the same thing because the voice reads my eyes follow the words and my imagination blossoms in the same kind of way. How easy is it a platform to navigate, and how fun is it so that the child gets to enjoy the skill of reading?
Yeah, great questions. So the first thing I'll say is, when you're reading and simultaneously listening, both your eyes and ears are engaged, which means that your temporal and occipital lobes are both engaged. So there is twice the retention and comprehension, which is a good thing. Now, the other thing I want to mention is, when you think about a child in Barbados, for example, imagine reading and listening with a Barbadian accent, and not necessarily having to read and listen to someone from the UK or someone from America. The beauty about Simbi, and this is why the island is excited about it, is that anyone who's watching right now can log into Simbi, go to simbi.io, simbi.io, and they choose any book they want to read. And they see the book, they press record now, and they start narrating. And Simbi knows, it asks them for their accent and for their location. And so when another child in Barbados wants to read and listen to a fluent Bayesian accent, they're able to. And what we also see is that when you identify with the person that you're reading with, it does wonders for fluency. Now, in terms of your question about, how do we excite kids to read? It's a great question. Right now, if you think about the number of students that end up on Instagram and Facebook and are aimlessly swiping and scrolling, Simbi's mission is to motivate students to read more books more often. And so we employ a lot of exciting game design. We give you rewards, we give you points. What you see right there that create global impact, once a week you get a notification showing you all the countries that people are reading and listening with your voice. You're able to collect stars. You're able to upgrade into different levels. And the thing that teachers and parents love about Simbi is that after the students are motivated to narrate for social good, the teachers and parents can actually listen, and they can get data and insights to understand how well they're reading, where they may require support, and actually give them assignments directly through the app if they require that help.
That's great. So there are two ways in which we can assimilate ourselves with Simbi. We can read into it, record it, and make it available for others to hear us, or we can access it and listen to others while they read and eventually become confident and bold enough to be able ourselves to record for other people to read in our accent or native tongue. Does Simbi have any restrictions in terms of what books are made available on the platform?
First of all, you just summed it up so beautifully. So the pedagogical approach is turning learning readers who read along into reading leaders who are narrating and giving back to the global community. In terms of restrictions, we license a lot of content. So we work with hundreds of publishers around the world. We also create a lot of content. And on top of that, actually on November 16th, this coming Tuesday, we are doing an amazing workshop with many Bayesian authors and artists. And so if you go to simbi.io/events, if anyone's interested in getting their content onto the platform, please check it out. And we'd love to have you and your content on it.
That's fantastic. I mean, that's a wonderful opportunity for any author on the island to have exposure, for sure, for their literary works. So we go to Simbi, simbi.io/events, and you can speak to you and make arrangements to have my work uploaded onto the site as well, and for people to hear it as they do as well.
Yes. And Pearson, I just want to tell you, you have such a lovely voice, and the Morning Barbados has such a wonderful tone to it that I would love to hear your voice in one of these books. Possibly with Morning Barbados playing in the background.
Aaron? Thank you, but that's another matter for discussion a little later on. So help me understand now how you're actually going to move this technology into our education system, because it's so vital, it's so necessary, so needed. I can see how it works in the home environment, one-on-one parent and child, but how does it integrate now into our education system?
Yeah, that's a great question. It really starts with educators, and it starts with educators seeing the benefit. So SIMBI is traditionally used by schools and school districts, where we have hundreds of schools in a school district will adopt the platform. And really the objective here is to just provide Bayesian educators with as much value as we possibly can. We recognize that it is an exceedingly difficult time to be an educator and to be a student. And so the next steps at this point are working with more educators and ultimately bringing it to the ministry level. And so it looks like in the not too distant future, SIMBI will be available countrywide, and that's kind of the direction that we're hoping to move in.
This is really brilliant work, and I really hope that parents, teachers, educators, everyone just embraces it enough. And I see here that you're looking eventually at one point in time to having readathons. I know Sandy Field-Kelman is so passionate about that at some stage we can all sit together in a space and we just read till thy kingdom come and enjoy the art of reading. And that's what you're hoping to do here, to create that space in our minds, in our consciousness, where we see reading not to be a chore, but to be something to be enjoyed. But most of all, it's for lifelong living. It teaches you a whole lot. And I commend this to all today. So again, it's simbi.io. That's the website to which you go, see and read, know more about what happens there with the application, the platform. But most of all, for those of you who have literary works and you want to be a part of it as well as a publisher and author, just remember simbi.io/events and start the process of getting your work on the platform as well. It's absolutely free to everyone. We can all be a part of it coming up on Tuesday. Aaron Friedland, thank you so much for joining us this morning. Did you want to say something?
I just wanted to specifically thank the Barbados Association of Reading and Read for Life, who have moved this initiative forward and who approached us originally, and without them we wouldn't be here. So to both those organizations, thank you. And Pearson, thank you. Really a pleasure.
Welcome. You're welcome. A pleasure for myself too. When I'm done here, I'm going online. I'll check it out myself. I need to see how it works. I need to hear how it works. I need to experience it. And I want to encourage everyone as well to go out there and experience it for themselves. Aaron Friedland, thank you. Now, we're going to take a break here. And when we come back, we are going to meet a Bajan afar. Stay with us.
Morning, morning, morning. Good morning. Good morning to you.
"26 minutes now to 8 o'clock. This Bajan afar is a St. Andrew girl. Good morning to you, Tara Dowrich.
Good morning, Pearson, and good morning, Barbados.
So good to see you all the way over there in Nova Scotia, Canada. How is the temperature today?
I'm actually in Toronto.
Oh, you're in Toronto.
Canada.
So what's the temperature like today?
It's pretty chilly.
It is.
It's pretty chilly. Pretty chilly.
It's not like sunny Barbados, right?
No, I do miss the sun.
You've been there now since 2016. How has it been for you, though, settling and getting your feet immersed in the culture of Canada?
It's been great. It's definitely different to Barbados. It's very diverse. So there is a lot that you can learn here.
Now, someone would ask, what are you doing there? How did you get there in the first place?
Well, I do have some family and friends here that actually helped in the process of relocating. And I came here because, well, like most people, for opportunity to see where it takes me in life.
Yes, indeed. But so far you've settled and you're very comfortable where you are. Do you like it?
I do love it. Barbados will always be home. I do miss the beach, but I do love it here. There is so much to do.
Yeah. Do you oftentimes have many flashbacks about life in Barbados that would make you sometimes feel a little bit sad because you're missing it?
Yes, I do. I do miss my family. I do miss my mom and my dad. I'm fortunate that they're still, with us. They're still alive, so I miss that. Like I said, I miss the beach as well.
You don't miss the food?
Of course, I miss the food.
What do you miss most?
It's so hard
Yes,
to
go
get
ahead.
decent Barbadian food here.
Yeah, I can imagine, unless you cook it yourself.
Unless you do it yourself.
But do you cook any Bajan food while there?
Sometimes, mostly my friends.
Mostly your friends. You're just one of those lazy girls in the kitchen, no problem. So what is it that they love to cook while there? I'm just curious, Tara. What Bajan foods do they cook?
We do macaroni pie,
Top stuff.
rice and peas,
Yes.
baked chicken.
All right, I get it. Don't make my mouth water so early in the morning. I get it. But you are a sports girl. You went to the Allen School.
Yeah.
You were always into sports and fitness and the like. And so you've continued that tradition while in Toronto.
Yes, I have.
So
Yes.
what-
Yes, it did start, I would say, at St. Andrews Primary. I was always very active. Then transitioned into Allen. I was playing netball at first. Wanted a bit more of a challenge, so I picked up basketball. And then I was playing for the combined schoolgirls team, and then I went on to play for Challenger Sports Club. I also qualified for the Barbados National Senior Women's Trials as well.
Wow. That is that is quite a resume you've got there as well. Thank you. I'm so happy for you. So you now moved your way into being a coach and a fitness instructor. So talk to me about that and what is it that you're doing?
Sure. Well, initially, basketball is what led me into fitness because I wanted to be a better athlete. I wanted to be stronger, faster, have more power and explosiveness on the court. So I got into fitness because of that. But then I realized that, there was so much more to fitness than just athletic performance. There were so many benefits. I realized it was something that I was very passionate about, actually one of the very few things besides sports that I was passionate about. So I decided to make a career out of it. Now I'm about a year in. I actually graduated last year, got my personal training certificate, also the award for the most outstanding student. And then when I was actually interning at a gym, and when the pandemic started, gyms closed. So I was forced to find an alternative option, and that's when I created Train with Tara.
So you have now Trained with Tara. And Train with Tara, no doubt, is going to be also partially online, in person and online as well. So talk to me about anyone all the way over here on beautiful Barbados who wants to train with Tara. How can we access your training workouts?
Sure, of course. So I do have 3 options. I have in person for those in Toronto that are close by.
Yes.
But for Barbadians that may be interested, I do have the option for Zoom. And also there's the option for the busy bees, for people that are busier and may not actually have time to work out on my schedule. There's an app called Trainerize that I use where I create workouts, programs, there's nutrition information and stuff like that on the app, and you can use it at your convenience.
I'm watching a video here of you lifting some weights. How heavy is that?
This was last year. It was not too heavy. I think it probably was about maybe 100 and something.
You made
100 and
that
a little bit.
You made that look like a piece of cake. You know how many men in this building would struggle perhaps to lift that? Just a gas bottle alone will give you licks to lift up. But you've done it so easily and so well. Being Barbadian in Toronto, I know it's one of those melting pot places where so many Caribbean people could come. How has it been for you maintaining your identity as a Barbadian in Toronto?
Honestly, Pearson, sometimes I lose myself, even with my accent, because I find that I am forced to adjust to some people in order for them to understand what I'm saying, especially working with customer service. So that's a part of me that I try to, remember when I'm speaking with my friends and stuff. And also, you mentioned food. Sometimes in order to remember myself, I might buy a Tiger Malt or a Shirley biscuit, something from back home, just to remind me, this is who I am.
Yeah, I can imagine. But there's some people who we know, we've met on this show before. Fabian Mears is one of them. He operates a Bajan kitchen in the area. So we just check our Facebook. Yeah. You know him? You're not as though you know him.
I know the Bajan kitchen, yes. I've tried it before, yes.
Right, so there you go. So that's one place you can try and really make sure that you have enough supply of everything that reminds you of being Bajan. When was the last time you were home?
Actually, now since I've been here, 2016, but fingers crossed, I want to come down next year. It really depends on the pandemic and everything, how everything's going, but I really want to come down next year.
Tara, you are missing so much. You are missing so much. Do you keep abreast of the news? Do you keep abreast of all of the happenings in Barbados?
I try my best to. I know that you guys are on curfew right now.
That's just 9 o'clock in the night till 5 a.m. That's all right, unless you're a night girl. But we're transitioning to becoming a republic by November 30th as well. So that's a biggie that's happening. There are going to be some big celebrations, which I don't want you to miss. Of course, you can keep watching us here at CBC TV online, and you can see it for yourself.
I'm subscribed.
Yeah, there's a lot going on. So if you were to land in Barbados now after being away for more than 5 years, where's the first place you'd like to go?
The first place I would go is to see my mom and dad, Mary and Anthony, and then probably to the beach.
You going back to St. Andrew to East Coast Road?
Of course, I love it up there. I miss Party Monarch.
Yes, you're so right. You've missed Cropover. You've missed that we've shifted now that big weekend into the botanical gardens. You missed so much. Tara, you need to come home. You need to come home.
I need to.
Yeah, and if you were, what would be the first thing you'd like to eat if you landed on the island right now?
First thing I'd like to eat. That's a good question. I haven't had pudding and sauce in a while, I think.
And tomorrow's Saturday.
And some fish cakes.
You hit the right spot there, Tara. And some mobby, right?
Mobby, for sure.
For sure. You are such a Bajan girl, and I love that. I love it indeed. When people ask you about Barbados in Toronto, what do you say?
I say it's a paradise. You must visit. You must.
It's a paradise you must visit. I love it indeed. What's your favorite Bajan song that you're almost your go-to song to immerse yourself back into feeling good Bajan while you're there in Toronto?
Oh, any Bashment Soca. I like Stiffy. I like all the Bashment Soca artists.
You are a Bashment girl. Who would have thought? Looking at this angelic face on TV, who would have thought that this was a Bashment girl? I'm shocked, but that's all right. That's okay. Your mother, would that shock your mother and father to hear you say?
I don't believe so. No.
They know their daughter. Where is that? They're in St. Andrew at the moment. Where are they in St. Andrew?
My mom's in Belle Plaine, St. Andrew, and my father is located in Titchborne, St. Michael.
Okay, well, there they go. And they're watching their beautiful daughter on the screen this morning. You've made them so very proud. I'm already beginning to tear up because I'm sure they are bursting with pride to see their beautiful girl there. She's done such a wonderful thing for herself, quite a success as well. How challenging has it been for you maintaining your business in the face of the pandemic? Personal training, this one-on-one thing, we're restricted in so many different ways. How has it been for you though?
It has been a little bit challenging, but I do provide multiple options, so that does help.
Yes.
And I also work for different companies. So even if my business might not be going, the best to its ability, like the greatest, then I can still have additional income coming in from a different company as well.
Yes, you've got your head on in the right place. Miss Tara Dowrich, Miss Pudding and Sauce, Fish Gates, Mobby and Bashment Girl from St. Andrew. Thank you so much for joining us this morning. It has been our pleasure meeting you and being able to say how proud we are of what you're doing there, how you represent us so beautifully in that Toronto, that big state, that big city in Canada as well. Keep doing what you're doing, and you're making us very proud. Thank you, Tara.
It's a pleasure, Pearson. Thank you so much for having me.
You're very welcome. Tara Dowrich, Barbadian. Her mom's in St. Andrew, her father's in St. Michael, but she's a Bajan to the bone, and she's doing so well there in Toronto. We're coming back to meet the brains and the beauty, the boss lady of Colleen's Beauty Supplies right after this.
Good morning. Can you hear me?
Morning, morning, morning. Good morning. Good morning to you.
12 minutes now to go to 8 o'clock. For a long time, you've gotten familiar with the name Colleen's Beauty Supply there in Carlton's complex in St. Michael. And it's the same old place offering the same great variety of beauty care products and hair products and a whole range of other things as well. But it's under new management. We meet the new boss lady this morning. Her name is Shania Armstrong. Good morning to Shania.
Good morning, Pearson.
Thank you so much for joining us this morning, and congratulations on assuming responsibility now for Colleen's Beauty Supply.
Thank you very much, and thank you for having me.
You're very welcome. Actually, it was on July the 1st that you took over the business. And, you know, it's a long-standing tradition for a lot of people to go into Colleen's Beauty Supply to get what they're looking for. You could find hairpins in Colleen's Beauty Supply. What changes... Yeah, what changes have you given thought to making to Colleen's Beauty Supply, if any at all?
So I've taken over ownership from Lady Tate, and she has built such a beautiful legacy. The changes that I've made, I've done a mini rebranding. I decided to keep the name, and so all across the front of the store, you can see the blue. You can see the blue behind me. That's my favorite color.
Yes.
And we've done a new logo. It's called Beautiful You. And I'm looking to expand on what Lady Tate has already built on her legacy.
You're very young. You're just 39 years old, and you have taken on quite a legacy to continue. Do you feel any pressure at all? And what, at 39, what made you think that you were bold enough, good enough, competent enough to take on this legacy?
It's just funny how life happens. We happened to hear that, you know, Lady Tate was ready to give away her baby, and I just thought, you know what, I'm going to jump into these big shoes and just do my best to carry on the legacy. I love beauty. I believe that everybody should feel beautiful within themselves, but also, you know, obviously the products do help with hair and nails. It's a lot that I've been learning as well. In terms of the nails and the hair, and I'm excited. I think I would say I'm more excited than nervous about it.
That's really, really good. It's good to know that even now you still feel this passion, this excitement about it, because it's more than just playing with bubbles and beads. It's business, Shania, and sitting down to chart the way forward, to managing it day by day, moment by moment in itself. For a lot of people can cause you to have gray hair, but look at you, you don't. And fortunately, you're still quite young to be able to live it out. What scares you most about this new venture?
If you use the word scare, I would just say that the pandemic, COVID, it has been a leap of faith because, of course, as you know, businesses are closing and you just don't know what's ahead of us the next week, the next month, or the next year. I think it's important to just remain positive, though. I have so many ideas. I actually feel like I want to do everything now, and I have to remind myself to take baby steps. It's just been 4 months, and we've covered so much ground in that time. we are on social media now. I was really happy to get it onto social media. Of course, I saw Lady Tate just yesterday, and she's like, "How did you, get onto social media so quickly?" And so I'm navigating my way there because I know, again, with the pandemic, that with people at home and on their phones, that's a way to reach the public effectively. So I'm really trying to push the social media now myself, and I'm learning in that area too. But again, it's exciting.
What kind of experience did you have coming into the position that you hold now as the boss lady of Colleen's Beauty Supply?
In terms of beauty itself or business?
Beauty, business, whatever experience it is you want to share.
I mean, I've worked for companies before, the Hilton hotels across Europe and London, and then I worked at Terra Caribbean in Barbados. So as an entrepreneur, I'm a new entrepreneur in Barbados, and I'm proud to be another female entrepreneur just doing my little bit in the island.
And you're also a mother, and that is another big responsibility of yours. Have you given thought to how you balance everything while taking care of your little sweet one?
Yes, yes, they're my heartbeat, so they come first above everything else. Actually, Colleen's Beauty has become like my third baby when I speak about it. So, of course, as you said, it is challenging trying to balance, motherhood, and of course, as you know, again with the pandemic, there's homeschooling. So I just try to manage my time as effectively as possible. Many times, I'm just on the go, just doing, whatever I can, whether I am in the office and trying to guide them with some homeschooling, or I'm there and I'm making calls at home and working from home. So you just have to do what you have to do. And my mantra is just to take one day at a time, really.
Quite right, one day at a time. Is part of your mantra also to teach your children, entrepreneurship, teaching them how to care for themselves and how to do it themselves if necessary?
Absolutely. Actually, just this morning, Mommy, why are you leaving so early? And I said, I was like, Mommy's going on a radio show, and they're so proud. They're also very proud. I see this actually as leaving a legacy for them as well. But definitely, I think self-care is so important, and that starts also from inside, affirmations and just being positive about yourself, understanding beauty from inside, but also understanding the importance of taking care of yourself on the outside too.
Can you give us your commitment to your long-standing customers that it will be the same? Some people get a little bit scared with change. Change upsets their pattern somehow. But you want to give the assurances today. What assurances can you give to those customers who've always patronized Colleen's Beauty Supply?
Absolutely. So, I mean, again, in the last 4 months, we've had a variety of customers where some have come in and they've said they love the changes, especially the younger generation. They love the new logo and that we're online. And then there are one or two who, of course, they've known Lady Tate for 20-something years. So it's kind of like, oh, where she's gone. Lady Tate is still around. She comes to the store almost every day. But as I said, for me, it's a case of building on what she's already established. So we are still keeping the main. She has some excellent brands in the store. So the Designs Essentials, Cream of Nature, Cantu. For the nails, we carry the Mia Secret Tammy Taylor. So we are keeping the excellent brands that were here before, and of course the service, and building on that. So it's a case of just expanding the variety. For example, we just brought in some Bath and Body Works and Baylis and Harding from the UK. Just again, so that when customers come, it's almost like a one-stop shop. You can find everything. So,
the beauty product space, though, can become quite small given how many other people are also doing it. And so, what do you think it is that makes Colleen Beauty Supply now stand out as the #1 space that we should consider when we're looking for hair care, skin care, any kind of product to make you feel beautiful?
Colleen's, again, the name speaks for itself. As I keep saying, Lady Tate has, established a legacy here. And again, I notice it where, even with customers come in or even on social media, I'm getting a lot of requests for certain products or items. Somebody asked for skin rollers the other day, and I just make it a priority. I've been making actually a list and a note so that if we happen not to have it, I make sure that I go out and I source it, so that, again, like I said, it's a case where when customers ask for a specific item, that they can come and they can find it here. And like I said, that the service just remains top-notch.
Well, see, that's great assurance for everyone watching today. For those of you, go inside to Colleen's Beautiful. They're having an independent sale, by the way. And if you've never been in there before, you gotta go now. There's some beautiful changes under new management, but the color scheme has changed. You're now on social as well. So check it out. Re-energize 21st, 22nd century store it is almost now under new management with Shania Armstrong. Shania, thank you so much. Much success with this endeavor as well.
Hope to see you here soon.
You never know. Thank you very much as well. Thank you so much. Shania Armstrong is her name. She's the new manager and owner, the boss lady at Colleen's Beauty Supply there at the Carlton Complex in Blackrock. Thank you. All right, before we go, a few things we want to remind you of. Don't forget that at ENCF all weekend tomorrow and again on Sunday, they're having those movie nights, NIFCA Gold movie nights, Saturday and Sunday, 2 different show nights. So don't think that if you go on Saturday, you wouldn't see it. Same, different night, different shows both nights. But you need to reserve your car space because it's a drive-in, so to speak. So you go to ticketlinks.com and reserve your car space. No seating will be allowed outside of your vehicle, so it's very critical that you reserve your car space. All protocols will be in effect. Refreshments will be on sale. Doors open at 4 because showtime is at 5 in the afternoon. And it's about 2 hours or thereabouts you'll spend. You don't want to get you home before COVID time curfew starts. So that's it. Tomorrow and again on Sunday, NIFCA Gold movie nights in the car park of the National Cultural Foundation. And it's going to be like drive-in style. You just tune in and you listen to your car. So you got to have your car space reserved. So all the best with you on that. Also this weekend, tomorrow, our girl Shay Greenwich and the YMCA, they're going to be unveiling that mural on the YMCA ground in Pinfold Street tomorrow from 9 o'clock in the morning. It's a labor of love, and so we will all want to love it too when we see what it is as we build youth, build a better Barbados in the mural, which has been ongoing, an initiative of the YMCA, all part of this whole big YMCA and YWCA week. Also, we just want to remind you of EQI Caribbean. For those of you looking for a dedicated service as well, go online to eqicaribbean.com. If you have a service to offer, you can register and put it up. If you are looking for something, whether it's a job, a quotation or whatever, that's the website that you go to. And you can actually connect with business people, connect business with clients as well, and you will see the benefits of doing so. eqicaribbean.com is the website. Keep listening to the radio. We've got some exciting things happening. And as you listen, we want to encourage you to stay with us on our 3 stations of choice, 98.1 The One, 94.7 The Best, 24/7 All Beijing, and Q100.7 FM. We got to say goodbye to you today for our small team of Renewable Ford, Nadia Foster, Anderson Nurse, Christopher Blenman, and Ryan Kennedy at Master Control. Thank you for joining us this week. We look forward to seeing you again on Monday, should it be God's will. Take care. Bye-bye.
Wake up, wake up, wake up, wake up. Barbados, get up. Good morning.